So do you know there was a plan out there that covered absolutely everything? So before 2020, this plan was available, and actually 36% of people who have supplemental plans are still on this plan. So the question is, what happened to this plan? Why did they remove it? And what options are you left with today? Hi, I'm Erika Smiley with MedicareSchool.com, and I want to show you the smiley side of Medicare. It doesn't have to be stressful. It doesn't have to be confusing. And I'm one of the lead educators here. I work with Marvin Music and our team to make videos like this to help you get the education you need and make Medicare simple, really. So in this video, we're going to look at this plan, the Plan F. We're going to look at where did the plan go? If you had a Plan F, should you keep it? And then most of all, what are your options if you're not eligible to get this plan? So we're going to talk a little bit about supplemental plans today. But first of all, what is a supplemental plan and why do we have one? Well, if you remember, Medicare has gaps. Original Medicare Part A and Part B actually has 6 different gaps. There's 3 gaps on the A side, there's 3 gaps on the B side. And really, one of the worst decisions you can make is just to stay on Original Medicare. Because Original Medicare, it's going to pay 80%, but you have a 20% co-insurance. This is probably the biggest risk with just Original Medicare because there's no cap on this. If you have a $300,000 bill, $400,000 bill, you would be responsible for 20% of that with just Original Medicare. So we need something to fill these gaps. And we've got 2 options. So we can go with a supplemental plan, which we're going to talk about today. Those are also known as Medigap plans. And when you get a supplemental plan, that works with Original Medicare. And then we also add a Part D plan as well. So Part D is your prescription drug coverage. Okay, so that's one route. Another way to fill the gaps, a lot of people will go with Medicare Advantage plans. So Medicare Advantage plans work very differently. They have the drug coverage built in, so you don't need a separate drug plan with that. But what we're really going to talk about today was this plan that covered everything. It was literally first dollar coverage, and people who were on this F plan didn't have any bills. It was truly the most comprehensive coverage. So these different supplemental plans, they're named by letters. So you might have heard we just talked about the Plan F. We'll talk about the Plan G, the Plan N, but there's 10 different supplemental plans. Now these are offered in 47 different states. If you live in Massachusetts, Minnesota, or Wisconsin, you still have access to these plans, but they just have different names. So they might be named something different than a G plan or an N plan. So first of all, with a supplemental plan, to qualify for one, you have to be enrolled in Original Medicare. So you need to make sure you're enrolled in Part A and Part B. And what's great about supplemental plans is they have a lot of freedom. You can go to any doctor in the United States that accepts Original Medicare. So all you do when you go in the doctor, you'd show them your Original Medicare card, and then you show them your supplemental card as well, okay? Now, the best time to get a supplemental plan is during your open enrollment period. So that's also known as OEP. You might hear it called OEP. And this actually lines up with your Part B start date. So when you enroll in Medicare, that might be when you're turning 65. It might be after 65 when you're retiring and coming into Medicare, or maybe you're losing credible coverage that you had through an employer or that you had through your spouse's employer. Whenever you start that Part B, you get something called the Medigap Open Enrollment Period. And this is super important time because you're going to have 6 months from this Part B start date where you are guaranteed to be issued a supplemental plan. So they're not going to put you through medical underwriting. You don't have to qualify. You're guaranteed to get the plan if you're in this 6-month window. So if you've had cancer, heart attack, stroke, diabetes, anything like that, this window, this 6-month window might be your one and only chance to ever get a supplemental plan. So make sure you know and remember that OEP to get one of these plans. Now let's look at the different letters and what these plans are. So there's 10 different letters that are supplemental plans. We've got A, B, C, D, F, G, K, L, M, and N, okay? Now, 2 of these plans you can no longer get. So the C plan and the F plan, which we're going to talk a little bit more about today. Now, unless you are eligible for Medicare before January 1st of 2020, you can no longer get the C plan or that coveted F plan that everyone really liked because it was 100% first dollar coverage, okay? So with those going away, we have a couple more that became more popular. But first, you see here I have some red stars next to some of these plans. So it was the C, the D, the F, the G, the M, and the N. With these plans, they had a little bit of foreign travel coverage. So it was up to $50,000 of foreign travel coverage. A lot of people don't realize Medicare is a U.S. federal program. So Medicare is really only good in the United States, right? So if you're traveling, and a lot of you are going to be traveling in retirement, and you're in another country, you do get some kind of coverage. It's up to $50,000 with the G plan, the N plan, the M plan, the D plan, and it used to be the F and the C. But still, we would recommend always, if you're going on vacation and you're going to be in another country, it's good to get a separate travel policy. That's always a good idea. But some of these did have that foreign travel benefit with it. So with the C plan and the F plan being gone, what are the next most popular plans? And really today, I'd say the most popular plans are the G plan and the N plan. And if you watch a lot of our videos, you'll hear Marvin talk a lot about the G plan and the N plan and the benefits of both. In 2008, the F plan was so popular, more people were enrolled in an F plan than they were an Advantage plan. So there were actually 9.6 million people enrolled in F plans and only 7.6 million people enrolled in Advantage plans. So it was such a popular plan. Let's look at what it covered, because it had what was considered first dollar coverage. So you're literally getting no bills, and after you pay your monthly premium, it covered everything. So let's see here the different benefits that we had and the different gaps. Your Part A coinsurance, so that's when you're in the hospital. It provided up to 365 days of a benefit after the Medicare benefits expired. So the F plan covered it. The Part B coinsurance, that 20%, F plan covered it. The Part A hospice coinsurance or copay also covered. Skilled nursing facility, so the copay for a skilled nursing facility, if you leave the hospital and you had to go recover in a skilled nursing facility, the F plan covered it. The Part A deductible, so a lot of you know this year the Part A deductible is $1,676, and that's not just a once a year deductible. That Part A deductible, that's a benefit period deductible. So if you go in the hospital a couple times a year, that's a 60-day benefit period. You could had to have paid that $1,676 a couple times a year. So the F plan covered that. Okay, the Part B deductible, also covered by the F plan. And lastly, there's an excess charge. So the Part B excess charge, most doctors accept the allowed Medicare amount, but some doctors can say, hey, we're going to charge over this, and they're allowed to charge up to 15% over this amount. So some plans don't cover that excess charge, which we'll talk about, but the F plan did. So if you look here, why would somebody not want the F plan, right? It's giving you very comprehensive coverage after you pay that monthly premium. It's great. You don't even have to think about it. As long as you're going to a doctor that accepts Medicare and you're having a procedure or a service that is covered by Medicare, you're going to be good. So, why did this plan go away? So let's talk a little bit about this first dollar coverage. So what happened is a lot of people thought this is bad, right? Because if people have this coverage, complete coverage, where they don't even have to pay a copay, they don't have to pay anything, they're going to go to the doctor too much. There's going to be an overusage of their insurance and doctor's visits. And they said, hey, this is going to cost Medicare a lot of money. And there's been talk for years about Medicare is going to run out of money, right? So they were looking for ways to cut costs. And also they were worried about this flooding and overwhelming the healthcare system. If everybody has this great coverage and everybody's going to the doctor for every little thing, then that could really put a big strain on the healthcare system. Now, people on the other side who are more into preventative care, said, hey, this is great. We want people to go to the doctor, right? This is why we have insurance. This is what we want. If people go to the doctor more often, then that's going to help with mortality rates, right? It's going to lower hospitalizations, because really what costs a lot of money and what costs Medicare a lot of money is where people are hospitalized. So people on the other side of the coin said, no, this isn't a bad thing. This is good. People are going to the doctor and getting the care they're needing. It's going to help with mortality rates and less hospitalizations. So who actually won out was between these two sides? Well, it's clear, since the F plan's no longer here, the people who wanted to save money and did not like, everything being covered, they didn't like this first dollar coverage, they won out, and that's why the F plan's no longer available. So Congress passed what was called MACRA, the Medicare Access and Chip Reauthorization Act, and they said, F plan's going away. It's no more, right? But they said people who had the F plan were still allowed to keep the plan. But if you were not eligible for Medicare before January 1st of 2020, you could no longer get an F plan. So that left people with having to turn to other supplemental plans. And now that kind of emerged where G plans and N plans are now the most common and the most popular. So let's look at these plans compared to the F plan and how comparable are they. So the G plan is really just going to be a step down from an F plan. So when we look at all of these, again, the Part A coinsurance, G plan will cover. Part B coinsurance, G plan's got it covered. That Part A hospice coinsurance or copay, also covered. If you're in a skilled nursing facility after you leave a hospital, that's also going to be covered. The Part A deductible, again, that's a benefit period. It could be multiple times a year. The G plan's got you covered. The Part B deductible. Now here's where we don't have coverage with the Part B deductible, okay? And what does that look like? Well, this year in 2025, the Part B deductible is $257, okay? And now that's just a once a year annual deductible, and that resets every year, okay? Now the Part B excess charge. So again, that's that 15% of overage costs that the doctors can charge. And there's actually 7 or 8 different states where they're not even allowed to charge this. So there's not a lot of doctors, it's less than 5%. But the G plan does have you covered with that. It's going to cover excess charges as well. So really, the F plan went away, and that was a bummer because people think, wow, that was the best plan, right? My friend who's 72 has an F plan. I wish I could get one. But if you're coming into Medicare, the G plan is almost the exact same plan, except for you're paying a $257 once a year deductible. So really not too bad considering it's covering mostly everything else the F plan covered. So the G plan right now is the most comprehensive you can get if you're just now coming into Medicare. So if you decide not to go with the G plan, and sometimes people do that because of the price, we're going to talk a little bit about pricing. Prices can be different depending on what state you live in, if you're male or female, what your birthday is. But the next step down from a G plan is an N plan. So the N plan is still really comprehensive coverage. Let's kind of compare that to the F and the G. So first of all, that Part A coinsurance is going to be covered. It's going to give you up to 365 days after the Medicare benefit has expired. Part B coinsurance, it's got you covered. Part A hospice coinsurance or copays, also covered. Skilled nursing facility, you leave that hospital, you have to go recover in a skilled nursing facility. The N plan covers that. The Part A deductible, so again, that's a big one. It could be $1,676 multiple times a year if you're outside of that 60-day benefit period. The N plan has that covered. So really, it also does not cover that Part B deductible, so we're looking at $257, just like the G plan. But the N plan also does not cover that 15% excess charge, okay? So now, this could be a big one. If you go get a surgery, you end up having a heart surgery or major surgery or cancer treatment, and you're at a doctor who charges that excess fee. But really, with the N plan, you can find that out. Just call the office ahead of time and say, hey, do you guys accept the Medicare allowed amount, or do you charge excess? And again, it's not very common. It's less than about 5% of doctors in the country who do this. There are some states where they're not even allowed to charge excess. But with the N plan, if there were excess charges that could be up to 15%, you would be responsible for that. So again, not bad coverage when we look at all of these. The only other thing also with the N plan, you didn't have any copays when you went to the doctor with an F plan or with a G plan. With the N plan, you could have some copays. They're not a lot, maybe up to $20 if you go to the doctor, a regular doctor's visit, could be up to $50 if you go to the emergency room. But if you're healthy right now, you don't go to the doctor a ton, and you just check for that excess charge, the N plan is still a solid plan. So you might think, well, why would somebody go with the N over the G? And really it comes down to pricing, right? You have to do what's in your budget. These are very comprehensive plans, but they have to be affordable for you. So the G plans right now run anywhere from, I'd say, about $150 to $180. Again, depending on where you live in the country, if you're male or female. Males versus females. Males tend to be a little bit more pricey. I don't know why, but it can depend on your age, male or female, and what state you live in. But I'd say these are about the average ranges in the United States for a G plan right now. They might be a little higher in some areas. They could be a little less in some areas. But the N plan, the average price right now for an N plan is $122. So you could save a little bit, up to $30 or $40 a month with that N plan. And that can add up, and it's still going to be very comprehensive coverage for you. So let's talk now about the F plan. If you have an F plan, you're one of the people lucky enough who were eligible for this plan, and you got this very comprehensive plan that's covering 100%. Should you keep the plan? Or should you switch to something else? Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. So I'm a guide here at MedicareSchool.com, and I talk to people on the phone, and I help them get enrolled in Medicare and sign up for their plans. So it was interesting. I talked to a couple the other day. It was a husband and wife, and they were signing up for Medicare. So the wife was just now turning 65, so she's coming into Medicare through her IEP, her initial enrollment period. But the husband was 72 years old. He had been working, he continued working, but he was just now enrolling in Medicare because he's leaving his job. So he's leaving his employer plan. He was coming into Medicare same time as her through an SEP, a special enrollment period. So when they called me, they said, hey, we want to go with supplemental plans, right? So we look at the rates, we start looking, and the husband actually qualified for an F plan, that F plan that's no longer available, but he was eligible for Medicare before January 1st of 2020. So if he wanted to get an F plan still, he could. So we looked at some prices, and it did not make sense for him to go with an F plan. It made more financial sense for him to go with a G plan. So I told you I want to show you the smiley side of Medicare. Well, a big smiley side of things is saving money, right? So let me walk you through how this kind of looked for them. So we looked at the F plan rates in their area, and for him to get an F plan, it was going to be $227.83 a month, okay? So if we look at that yearly, that is $2,734 a year for that F plan. Now, yeah, it's great comprehensive coverage. Everything's covered after that, but that's just a little bit under $3,000 a year for that plan. So we looked up the G plan for him, and in his area, like right now, the average G plans are about $159. So it was somewhere around $159 for a G plan, which comes out to $1,879 a year. So you might be thinking, well, yeah, Erika, he's paying more, but that's the best plan, right? It's total comprehensive coverage. But if you look and do the math, he would have been paying $2,734 a year for that F plan. He'd only be paying $1,879 for that G plan. So if we subtract those two, the F plan would cost $855 more a year. Now remember, what does the F plan cover that the G doesn't? The only thing is that Part B deductible, which is a one-time deductible. So the Part B deductible this year is $257. So if you subtract that, he would have been paying $855 more for the F plan than the G. The only thing you're paying out of pocket more with the G plan is that Part B deductible, which is $257. So he would have actually been paying almost $600 more a year for that F plan. So I'm like, hey, it makes more sense. Go with the G, okay? So that was a rare situation where, if you are still working now and you're going to be coming into Medicare, but you were eligible, you could still get an F plan, right? If you were eligible for Medicare before January 1 of 2020, you could still get one. But the question is why spend more money for almost the same coverage? So another question you may have, if I have an F plan now and it's gotten really expensive, what are my options? I also had a call just this last week, and a gentleman called in, his mother is on an F plan. You might think, hey, great, lucky her, she has an F plan, but this F plan now, she's approaching 90, is over $400 a month. So it's gotten more and more expensive. And you might say, why are these prices going up? Why are rates getting so high for these F plans? Well, the way insurance works, it's all about risk pools, right? So you have a pool of people and we're spreading out the risk. And usually in an insurance pool, you've got new, young, fresh people coming in, right? You have people that are aging and they're getting older and less healthy, but you've got younger, healthy, fresh people coming into the pool. Well, since not many people can get these F plans, that pool's kind of drying up, right? Everybody in the F plan pool is getting older, they're getting more high risk, they're getting unhealthier, and so we're seeing those rates go up. So if you're in that situation, what can you do? So you can always give us a call here. It doesn't hurt to see if you could go to a different plan with a lower rate. Now remember, you're going to be outside of that 6-month Medigap OEP. We talked about that magical window that's 6 months from your Part B start date where you're guaranteed to get a supplemental plan. Now, if you're on an F plan now and it's gotten pricey and you want to look to go into another plan, you're going to have to go through medical underwriting. But you may pass. You may get through medical underwriting and we may be able to save you hundreds of dollars a month going to a different plan. So unlike Advantage plans only have really one time a year that you can switch them, that annual enrollment period from October 15th to December 7th. But supplemental plans, you can change them any time of year. You can go from an F plan to a G plan if you'd like. If you have one of those high-priced F plans and you want to take a look at a G, you can even go from a G plan to an N. We have people do that all the time where they just have tweaks. They want it to fit better in their monthly budget. You just have to go through medical underwriting. So that's not a physical exam or anything like that. It's just maybe 20 to 25 questions. They're going to ask you about your past health. They're going to ask about your present health, maybe what medications you're on. And you know what? It doesn't hurt anything. If your F plan is super expensive, it's $400 a month, and you want to see if you can get approved for a G plan, we can always do that. It doesn't hurt. It takes a few minutes to go through that medical underwriting. If you pass, you pass, and we could save a lot of money, right? If you don't pass, it's okay. The application doesn't even go through. You know, it's not like your current insurance company even knows you applied, and you just stay on your F plan. But that is something you can shop. You can give us a call, talk to one of our guides, and see if you can get through medical underwriting to go from an F to a G. Could be a lot more cost effective for you. Same thing if you're on a G now, and you might think, oh, this is expensive. I need to go to an Advantage plan. Well, give us a call. Let's check out an N plan first. Going from a G to an N could save you money. And again, you just have to get through that medical underwriting. So really, again, with the supplemental plans, whatever letter you have, a lot of people really are attracted to them because of the freedom. Again, there's no referrals that you have to get. If you want to go see a specialist, you don't have to go through your primary care doctor to get that referral to the cardiologist or to the orthopedic doctor. You can schedule those appointments without a referral. You don't have to have prior authorizations. So with the supplemental plan, if you need a surgery, it's just scheduling the surgery, right? You don't have to wait and see if the insurance company is going to approve that for you with prior authorizations. So you don't have to worry about that. You also don't have to worry about networks. There's no networks with these. They're open plans. You can go to any doctor that accepts original Medicare, which is like 98% of doctors in the country. So you have a lot of freedom. If you're going to be traveling, if you're a snowbird and you want to be able to have your medical care in different areas, the supplemental plans can really give you a lot of freedom and just make things easy for you. They're also yours for life. You don't have to change these plans all the time. I know we talked about looking at, an expensive F plan and going to a different supplemental plan, but normally when you get these plans, you just set them up and you don't have to think about it. This is supposed to be the best time of your life. We want you having fun, hanging out with the grandkids, traveling, not doing things like thinking about insurance all the time. So that's really nice with the supplemental plans. They're yours for life. They can never take them away because you're aging or because your health is declining. If you move, you can take them with you. And that's really whether you go with an F, a G, or an N. Okay? So if you want to look more into these plans or learn more about supplemental plans and your different state, what your rates might be for you, give us a call. That's what our guides are here for. That's all we do is Medicare at medicareschool.com. We're happy to answer your questions and help kind of take the stress out of things for you.